Hello, my name is Keandria Green. I am attempting to do cognitive therapy and Breif Eclectic psychotherapy. This is my volunteer, Marquise Matthews, and this is for homework purposes only. This is not real. Hello, how are you doing today, Marquise?
I'm doing good, thank you.
Good, good. And what brings you in today?
I'm going to be discussing trauma that I have of an experience I had dealing with the police being arrested at one point.
Okay, and can you tell me a little bit about that experience?
I'm sorry.
Can you tell me a little bit about that experience?
I was basically misidentified for a person that they was looking for that had the same exact car as mine, and I went through a whole experience with that situation.
Hmm. And do you mind kind of giving me details and diving into exactly what happened, the chain of events from start to finish?
Um, well, it was just a typical day driving around. Um, happened to notice that I was being tailed by a police officer at the time, and I made a few turns, left, rights, and he was still following me. Then he proceeded to put the lights. I guess he was checking the information. I assumed he had the information correct. If he was pulling me, but he pulled me over. Um, Basically, from the time he got out of the car to approach my car, he already had his hand basically on his gun. Got to the window, he pulled the gun out and demanded that I get out the car immediately, and demanded me face down on my chest. I complied, did everything I needed to do, and he proceeded to put the handcuffs on me. While calling for backup, I guess felt he needed backup, and then put me in the back of the car, and then that's when we went down to the station.
Okay. And what ultimately happened from that experience?
Um, Ultimately, I tend to get like small panic attacks if I see the police behind me.
Hmm.
I feel kind of overly corrective, so to speak, like trying to make sure everything I do is correct. And it's just anytime I see a cop in my vicinity, I get nervous, basically.
Hmm.
So
You get nervous and you have panic attacks from that experience. So
yeah,
pretty much you were mistaken for a fugitive that they were looking for at the time, and you pretty much had the same car as the fugitive, and they pulled you over, and you were arrested, and you were pretty much given the fifth degree as if you were already guilty before they verified if you were the correct person. And then ultimately it resulted in you being arrested, put in a police car, and going to the station. When did they notice that you were the wrong person?
once we got down to the station and then everything checked out as far as my information, as far as my ID concerns, making sure I didn't have any previous warrants or priors, and through all that investigation, they figured out that I was not the person that they was looking for, and that it was all a big misunderstanding. So they basically let me go, and ever since that day, it's just been tough.
Hmm. And when you say you have panic attacks and you get nervous, what do your panic attacks look like? What does a panic attack typically involve for you?
Um, More so just not being able to think at a rapid speed, like losing my train of thought and just getting overly nervous, heavy heart beating, hands start to get sweaty, and uh, just just not being able to have control of the situation at that particular moment. Just trying to make sure that it's not going to happen again. It's not me this time. So
So typically, your reactions are based on that one event to where you're kind of sensitive to police officers even being in your vicinity because of even if you're not doing anything wrong, you could be possibly mistaken as the wrong person.
right.
Mm. And what have you tried to do in order to kind of suppress those thoughts or work through that feeling of panic attacks? Because panic attacks can be very um, stressful sometimes.
Um, so I've done some small small types of therapy here and there,
Mm-hmm.
as far as basically trying to do these small breathing exercises and techniques to kind of like in real time fashion to bring my emotions down, become more calm, and kind of try to gain my thought process back.
Mm-hmm.
So
So you say whenever you try to cope, you try to do breathing exercise. You've had therapy for this event before?
before this happened, I never had uh, any therapy sessions before. I didn't have to. I was never recommended, or I never had any reasons to, go see a therapist. But ever since this situation is kind of like was one of the things many people kept telling me I should do.
Mm-hmm.
So
And when you think about this event, what are your main feelings besides fear? Do you feel any other feelings like,
I
say,
feel
anger, or how do you feel about?
I feel anger, I feel resentment, and I feel aggression towards the fact of how the situation was handled.
Mm-hmm.
In the sense of the real time as it was happening, there was a lot of forceful uh, direction towards me. Get on the ground, don't move, put your hands behind your back, da da da. So it's like that person really had control over what I was doing at that moment, and you feel helpless.
Mm-hmm.
That's what I'm most angry about
Mm-hmm.
when I think about it.
So you do have feelings of anger when you think about that event, or whenever you see a police officer in general.
It's a combination of both because you never know if you're that target again. Even if they're behind you, that are driving or they're just following you, or it could be just running your plates. But when you've been through a situation like that, in the back of your mind, you feel like you're a target every time.
Mm-hmm. And can you tell me what was the most traumatic part about that event that is still kind of stimulating your mind when you see the police? Like what part, like what in each step of that whole event, what was the most traumatic part for you that creates that anger and that fear, or just your response to having
Having
a
a
panic attack?
Probably having a weapon pointed at you,
Mm-hmm.
and not knowing that you see your life flash before your eyes, and it could be all over behind the pull of the trigger.
Mm-hmm.
If he's not having a perfect day, or he may have woke up on the wrong side of the bed just this particular day, and at any instance or any moment, sudden movement, his hands on the trigger, you don't know. You can just pull it anytime, and it could be all over.
Mm-hmm. Yeah, so your most traumatic part of that experience was getting the weapon pulled on you and not knowing if you will live or die at that very moment, despite you being the wrong person. You know for sure that you haven't done anything.
Right. That's probably the most vulnerable you could possibly feel at that moment. Because
Mm-hmm.
you're not in control of the situation, and you don't know what the next person is thinking. And if for some reason he has it in his mind that he has to exert his authority and be power struck at that moment, then that's just what it is. You don't even know when it's coming. It just happens. And that's what the most fearful moment was, like not knowing what the next second might be.
Mm-hmm. And when did this happen? How old were you, or how long ago was this?
This is really fairly recent. This is like 2 years ago.
2 years ago. And have you had any other police encounters with law
I haven't.
enforcement?
I haven't. Um, Up until that moment, I haven't had any encounters. It was more, just every day doing the same routines every day, going the same routes, knowing where the police usually be sitting, and knowing the speed limits and stuff like that. You just, doing the right way. And it was just one particular day, and I haven't had any situations since then. Um, I rarely try to go out at nighttime unless I really have to. So
Mm-hmm.
I do a lot of driving during the day, but that's just some of the measures I try to take on my own, just off of self-preservation, so to speak, trying to prepare myself when I leave to go out to go anywhere.
Mm. So on top of the panic attacks that you have when naturally you're driving, police will be on the road. um, to assess traffic. You've also kind of altered your lifestyle to make sure that you're out of their way as much as possible, even though it's something that you really probably can't prevent.
Right. Yeah, try to basically, just get out of harm's way. That's what I tell myself. I know they're out here just to protect and serve, and try to make sure that we're, in the safest environment as possible. And that's just some of the measures I try to take to improve uh, that type of situation on my behalf.
Hmm.
So
So, not saying that you were looking forward to the next encounter, but how do you feel the next encounter would possibly be if you were to run to law enforcement again?
depending, well, I hope I don't have to, but depending
Right.
if it does happen, you just want to make sure you do exactly what they say. Try to be as calm and still as possible. No matter if it's a regular routine traffic check or if it's you may have had a flat tire pulled over to the side, they stopping to help out. So you just never know what the situation might be, but just always try to make sure that you have everything in plain sight and always ask questions before you do anything, and just try to make sure they see your hands at all times. So that's just some of the things that I know I keep in my playbook, just in case that situation happens again, which I hope it doesn't.
Right. I hope it doesn't either. That's a very unfortunate experience that you went through, and I applaud you for coming to therapy to try to, kind of get a handle on some of your reactions and your feelings towards law enforcement and just in general your overall health, because panic attacks can be very scary as well. Um, and in terms of the panic attacks and the anger, um, is it only when you see a police officer, or is it just a thought of what happened to you in that moment? Or does it happen any other time when you're doing your daily duties, like watching TV, or how deep is the trauma for you?
It's really only when I rarely have those uh, episodes when I'm just relaxing or doing anything uh, constructive on just my personal time. But it's just that anytime I'm around, anytime I'm driving, and there's a police officer in my rear view or somewhere close to where they look like they could be, you know, in an angle to see me doing anything wrong in their eyes, then I start to get nervous and try to, like I said before, kind of like overcorrect myself to make sure that everything is in the right direction of where I should be going and what I should be doing at that point.
Hmm. Okay. So, how do you feel about taking proactive steps to kind of talk with police officers about um, reform and just kind of how you could possibly, not be a target?
Just understanding what most police officers, uh, what they mostly give out as information as far as how their job is supposed to be done as far as to protect and serve first, but just kind of like weed out the good cops from the bad cops, which we can't do that because they all look the same, they all dress the same, they all do the same job. But
Hmm.
I mean, it's really nothing I can say proactive wise that I can say that I've done in regards to speaking with police officers, but just knowing by research and they they tend to have seminars and uh, workshops or whatever that could be posted online just for like frequent Q&A questions or whatever, and then you just kind of like look at it and see and understand for yourself and just try to take a mental note of what they're out there trying to do, and then if anything happens like that situation again, you know how to assess and you know how to move along with the process to try to make sure that it's a safe encounter between you and the officer.
Hmm.
So basically, just a bunch of mental notes that you put in your head. Just like, okay, do this step, do this step. Just hope that it's a pleasant meeting and we both can go our way.
Hmm.
And that's pretty much how I look at it.
Yeah. So basically, you have done, some type of research as far as just kind of knowing what the typical job of a police officer is, and you just never know because your situation was definitely unique, because you were not doing anything wrong, so you didn't really have a, conscience of, they're looking for me. It was more of a you were going about your normal day, and you happened to be at the wrong place at the wrong time, so to speak, and that's caused you to have a very traumatic experience to where you feel panic attacks, and ultimately based off of that experience you have anger, number one. You have vulnerable feelings whenever you see police officers, instead of the protect and serve feelings that you should have, because they are here to protect and serve all of us. And so how do you feel if you were in a situation where you need a police officer? Would you be hesitant to call them, or would you, are you not, it doesn't affect you in that area to where you can't have that involvement?
If there's a situation where I would put into a decision whether I have to call for my safety,
Mm-hmm.
and I understand that that's what has to be done, but depending on what the situation is, you just don't know if that's the right call to make or if it's not the right call to make, because you don't know who you're gonna get. You don't know if you're gonna get that cop that's gonna come and do his job, or you're gonna get that cop that's gonna come and just having the worst day possible,
Mm-hmm.
and then trying to, you know, solve his problems by taking it out on somebody else.
Mm-hmm.
But at the end of the day, that's the idea that you have to take when you making that call for a situation that needs to be handled in that manner. So I guess if it's that serious enough, I would call. But if it's something I could possibly handle on my own, then that's just what it had to be. But I don't know if I can make that call depending on the situation.
Mm-hmm.
It's just the fact that you feel like you've been taken advantage of before, that it could happen again.
Mm-hmm. I understand. So, when in terms of anger, what does anger look like for you in regards to law enforcement, or just that typical situation? Like when it replays in your mind, how does anger look for you?
Um, just a lot of like aggression that's built up, like a lot of pain and somewhat of a pain and suffering feeling,
Mm-hmm.
like just resentment and almost retaliation, but not to the point where you want to do something to somebody, but you just want somebody to feel the way you felt.
Mm-hmm.
But it's just hard to look at that situation and not have some type of angered feeling towards a police officer.
Mm-hmm.
So it's tough.
Yeah. And so, how long do you normally stay angry? Just is it a couple of minutes, or does it impact your whole day, or?
It's mainly if you're thinking about it, try not to think about it as much as possible. Just try to do things to get your mind off of it, to stay constructive in the other areas. But whenever you kind of get into that rabbit hole, just thinking about that situation and replaying that situation over and over, then you get lost into that feeling for a while. But it doesn't, not like it's an all day thing or just something that constantly happens. It's just if your mind wanders off and you start to get into that mode of what it felt like at that moment, then you
Mm-hmm.
start to think about it. But outside of that, it's really not something that I just dwell on 24/7.
Mm-hmm. And how often do you think about it? I know you say, it's mostly when we see police officers, or, whenever they're around, but a better question probably would be, what is your goal as far as dealing with your traumatic experience? Like, how do you see yourself responding better to whenever, you can decrease your sensitivity to the law enforcement so you can get to a better place mentally for yourself?
I think the biggest part would be time. Time heals everything. So it's gonna take some time to just understand what happened and why it happened, and understand that I'm not the only person that it's happened to, and get around people that it has happened to before,
Mm.
and that has came on the other side of it with an understanding or a better processing of what happened, and then that way you can help yourself getting through that and understanding that it was just, as you said in the beginning, just a wrong place at the wrong time type thing, and just do whatever it can to make you happy in everyday life and just kind of move on in that sense.
Mm. You said something very powerful just then. You said you're seeking out support or support groups. Have you tried a support group before?
Yeah, I have been to a couple, just to be able to get my thoughts out amongst other people and
Mm-hmm.
listen to what other people have to say about those experiences and kind of like just go through that as a whole, as a collective, and try to, once you get it off your chest, you can get it, back and forth with someone else who's been through the same situation, then you can kind of see how to get to the end of that tunnel with the light a lot easier.
Mm-hmm.
So yeah.
Okay. Well, yes, I would definitely encourage that for sure. Support is a huge part of community and having those answers that you may not typically have if you're in your own thoughts or dealing with it yourself. So of course, having somebody to talk to is definitely a great source to figure out what a best route could be as far as healing and just a transitional mind frame about how to deal with that situation and that trauma. So I would like to kind of breathe over a little bit to what we talk about in our next session, which will be brief eclectic psychotherapy. And that will involve me educating you, of course, about what that looks like and what that psychotherapy looks like. It's really to help you, again, suppress those feelings so where you don't have panic attacks and kind of restructure your thinking when you do see police officers, that you don't get panic attacks and you can't necessarily say that anger is going to come as fast, but the panic attacks is definitely something that is concerning just due to side effects of panic attacks. They can get symptoms can get worse. So it sounds like your symptoms are pretty mild. Just but panic attacks can lead to other things like shortness of breath, the chest tightening, that type of stuff. Depending on your health status, that's something that you definitely want to kind of focus more on as far as this situation and dealing with this trauma. And for the next session, what we'll be doing is we'll be writing a letter. How do you feel about writing a letter to not to anybody, but just in regards to that situation? If you were to write a letter to that police officer and let them know how you felt, how it made you feel, what could be done better next time, and literally just writing your feelings out, however you want to expressing yourself in that mode, and kind of getting those feelings out. How do you think that'll make you feel?
Um, to be able to get off my emotions and my feelings and how I felt at that moment, it potentially could be something that could be motivational and carry on to the next stage of what could possibly happen after that. So yeah, I guess it's something I could do.
Yeah. So we'll try to do that for our next session. We'll definitely sit down and I will let you write a letter in the office, and you can write how you feel. You can use whatever words you want to use. You can express yourself fully as if I was a police officer, and you'll share that letter with me, and then we'll go from there as far as addressing things that I might find that might be a little, little kind of underestimated feelings that you may have. And before we close, for the second time, have you ever thought about forgiveness from that situation, forgiveness of that officer and of the way that situation was handled? Have you forgave?
At this point, I haven't, but it's something I'm working towards doing. Maybe one day in the near future that could be a possibility, but I feel like until I do that, I might not get myself to the fullest that I want to be. So until I do that, that's probably gonna be the best thing for me. But I gotta feel it in my heart too. So
Yeah. Yeah, the only reason I mention forgiveness is because forgiveness, whether it's accepted or not, or whether you actually feel that way or not, is something to think about, because if it doesn't help that person, it definitely will help you. It helps you with your anger. It helps you with feelings of resentment. It helps you with feelings of feeling inferior, or just about in general, just for yourself, who you are as a person and who God made you to be, you know? So that's something we'll explore a little bit too, because that'll keep you in control of your life and your situation. Because whether they are, whether they are apologetic or not about what happened, because they were just doing their job, for you, you kind of put yourself back in control of how that situation can make you feel and alter your mood and alter everything that, makes up who you are as a person. And that's just something that we can just look at, as far as the ultimate goal to get towards, if that's something that you feel is necessary, but definitely can help you with anger and resentment for sure, and put yourself back in control of your own life and your own situation, and help you move towards clearer thinking to where you don't have those same, feelings every single time, or just kind of getting past this moment in a healthier way to where you can, you can improve your own life with or without an apology.
Right.
Okay? So, as we wrap up, our session is coming to an end. How do you feel about this, what we discussed so far?
I feel pretty good about moving on to the next steps.
Mm, that's good. That's good. So, I look forward to seeing you next session, and we will, like I said, we will come prepared, come ready, clear your mind, and or come with all your feelings. Either way, but just come, and we'll go to the next step of this brief eclectic psychotherapy, and we'll see how that works for you. Okay?
All right, thank you.
All right, thank you, Mr. Matthews. I appreciate you coming in today. It was a pleasure meeting you.
Thank you.
All righty.